Stomach pain is very common in young people. In its various forms, it can affect 20% of the young population. So 1 in 5 people will experience stomach pain during their childhood. And whatever form it takes or name we give it, it's a problem. You might not know, most people don't, but when it comes to pain, your brain is the most important part of your body. But this doesn't mean it's all in your head. Your brain reaches out into your body with a system of electrical wires, which are called nerves. And at the end of these nerves are sensors that pick up any information your brain might need to be aware of. Then your nerves carry this information as signals to your brain. So your brain always knows what's going on in your body. Now, imagine you're practicing sport and you get kicked. It happens sometimes. Sensors in your leg will send a signal through this nervous system up to your brain. Your brain already knows there's danger outside of you because you can see the kicker. But now the brain also knows there's danger inside of you, the damage to your muscles. Your brain receives this signal from your leg and then it produces pain to ensure you stay safe. So pain is an alarm that your brain activates to motivate you to do something that will keep you safe. When you feel this pain alarm, the first thing you'll do is rest, because this usually helps with pain. But when you're resting, you can't do the things you would normally do, those things you enjoy doing. Usually this is okay though. You take some tablets or you see a doctor and you soon feel better. This is called acute pain. It doesn't last for long, a few weeks or months, and you're soon back doing the things you enjoy. Ever found a bruise that you didn't know was there? How can you hurt yourself and not remember? But then you do remember. You were playing with your friends. You were all enjoying yourselves and having fun. You all collided and ended in a heap on the floor, laughing and enjoying yourselves. Someone had stuck their head into your ribs, but you didn't notice it. Why not? It must have hurt because it's left a bruise. Well, there are 2 things that can happen here. Firstly, the contact was picked up by the sensors in your body, which sent signals to your brain, but your brain wasn't aware of any danger because you were having fun. So there's no need for the pain alarm to be activated. Secondly, once your brain knows you're safe and having fun, it sends signals down through the nerves to block signals from the injury reaching your brain, so you can carry on having fun. And your body is getting knocks all over, but your brain just blocks them all out because you're safe. There's no danger. So when your body sends signals up to your brain to let it know what's happening down there, your brain can do one of 2 things. It can activate your pain alarm to motivate you towards safety. That means you stop doing anything that hurts and you get help. There are other times when your body sends exactly the same signals, but your brain chooses to ignore them and even sends signals of its own down to block them. This is important for you to know because it means that your brain plays an active part in your experience. It can decide when you have pain and it controls how much pain you feel. Now, let me tell you about pain that lasts longer than you or your parents or even doctors expect it to last. It's called chronic pain, but we'll call it persistent pain because it doesn't seem to want to go away. And there are reasons for this. Sometimes the nerves in your body can send information to your brain even though there isn't really much going on. This can be because you once had a problem there and your body has just got used to sending signals to your brain. Doctors call this sensitization. Let's just change the story for a moment and think about a house. Now, if you wanted to keep your house safe from danger, such as fire, you'd put sensors in every room that will detect smoke alarms. These sensors will be connected to a system of wires that connect them to a computer in the loft. When a sensor detects smoke from a fire in one room, it sends a signal up to the computer so it can activate the alarm. When everyone is safe, they can work out what caused the fire. And sometimes you need some outside help. What a commotion. So when everything's working well, the house and everyone in it are safe. It isn't a very nice experience, but everyone's safe and they can clear up afterwards. Now, imagine that this system, the sensors, wires and computer, gets even better at keeping the house safe, to the point where even a candle can activate the alarm. Or the cooker in the kitchen activates the alarm. Life's getting difficult, isn't it? Simple things that you want to do, sometimes things you enjoy doing, become impossible because of the faulty alarm system. And then things get even worse because even movement itself activates the alarm. There's no danger, no fire, no smoke, nothing. But the wiring just keeps sending up signals, and the computer in the loft just keeps activating the alarm. The fire brigade get fed up with coming out because they can never find the cause. The house is perfectly safe, but the alarm system keeps causing problems. So you have to take a different approach. Stop looking for fire and start looking at the wiring and the computer, because it's become sensitized. And that's what can happen in your body. So persistent pain isn't being caused by injury or damage. X-rays won't show anything, and doctors could spend a long time searching for answers. In a way, pain gets stuck. And pain doesn't just get stuck in your body, it gets stuck in your brain. When a signal comes into your brain from your body, it hits a structure called the thalamus, which is a kind of sorting station that alerts other regions of the brain. So it grabs the attention of the front of your brain, because that's where we think and where we coordinate our responses. So this brain region is activated and produces thoughts like, this pain is killing me, I need to rest. To make sure you stay safe, your brain brings in your emotional center, the limbic system, because it's our emotions that motivate our action. So you might feel anxious. Then these regions connect with your motor cortex, because that's where movement is organized. So you'll stop what you're doing and maybe lie down. And your thalamus can't help but activate your sensory cortex, because this is where your body is represented on your brain. And your brain becomes sensitized to these signals in just the same way as your body. Every time your brain receives the signal, that same response happens in your brain, which means your style of thinking is always the same. You always feel the same, and you always do the same thing. Pain is stuck in your brain.